Welcome to Kentucky. I'm going to take a prerogative just to say welcome to Louisville as well. In your little bag, you've got a name tag, a button pin, with different ways to pronounce the name of this city. It is not Louisville. It is Louisville. I hope that you do find some time to tour the city, explore what's available here. It's a wonderful city. It has all the amenities of a modern and successful town, museums, parks. The parks here in Louisville were actually designed by a guy named Frederick Olmsted, who you may not know by the name, but he also did Central Park in New York City. So Louisville has some really nice parks. If you do the walk across the river, coming back, you're going to see the outline and the skyline of Louisville. It's, again, I'm prejudiced. I don't live here, by the way. I live in Lexington, but it's a wonderful town. Louisville has a famous race first Saturday in May called the Kentucky Derby. So if you get to Churchill Downs and they have a museum out there, again, it's a nice place to go. The University of Louisville. Now you may have heard of the University of Louisville basketball team. There's a little coach named Rick Pitino who lives here. But the academic program has been just as successful as the athletic programs at the University of Louisville. And we have several folks here from the University of Louisville participating in this conference. It's very fitting that this Southern Obesity Summit be being held in Kentucky. Unfortunately, we have a lot of health issues in this state. We have an unhealthy population, and we have too many children who weigh too much. We know that, and we are engaged. So here in Louisville, Mayor Fisher, the director of the health department here, Quandra Nesbitt, have multiple programs. So if you see somebody from Louisville, particularly from the health department, say, tell me what you're doing, because there's a lot of stuff going on. At the state level, Governor Beshear, who's received national recognition recently because of the successful implementation of the Affordable Care Act, also has a lot of activities statewide trying to address health issues in Kentucky. Lieutenant Governor Aperson is actively involved, and you're going to hear more from Dr. Mayfield in just a minute, so I'm not going to steal her thunder. I'll let her talk about what we're doing. Yes, we have problems, but we are not passive. We are actively engaged, and I'm thrilled that the SOS is being held here in Kentucky this year. This is my fourth one, and it's really an honor for me just to be part of this program. This summit didn't occur by spontaneous combustion. It required the support of large numbers of people, individuals, and organizations to make it happen. And we'll be recognizing some people here in just a minute. But the person I want to recognize first, and most important, is our tireless leader, Carolyn Dennis. And so Carolyn, I'm going to let you come on up here because I'm going to give you the microphone in a second. But Carolyn, when I say tireless, I'm not talking about 9 to 5, I'm talking about 24 hours a day, 7 days a week, wears me out tireless. That's the kind of leadership that this summit has required from the Kentucky contingent. And so Carolyn, I'm going to let you say a few words.
It's been such a pleasure working with Dr. Hacker, Stephanie Andreas, and Michelle Smith at the Texas Health Institute, and many others to host this year's summit. I am thrilled to be here, and I want to thank each and every one of you for being here today. I do have to say, although I pronounce it Louisville as well, my husband was also raised in this city, and he insists that it's Louisville. I don't know how many other Louisvillians are out there who may debate it, but, you know, there are some differences of opinion. I want to point out that each and every health advocate here, and I think every single person here is a health advocate, and we have the opportunity, and I dare say the passion, to do what we can to make a difference in the obesity crisis. I believe we are making a difference, and that we can do even more if we gather information and share it widely, if we think creatively to craft and implement strategies aligned with the 7 pillars, and if we form relationships with policymakers, the media, and community leaders and call upon them to help lead this effort. We would like to recognize the great organizations who offered financial support of this year's summit. We had some wonderful support from our Kentucky organizations. First, the co-host of the Southern Obesity Summit in conjunction with the Texas Health Institute, Shaping Kentucky's Future Collaborative. The collaborative is a consortium of funders across the Commonwealth committed to more effective policies supporting healthy nutrition and active lifestyles. Specifically, I want to mention 4 of our member organizations: the Foundation for a Healthy Kentucky, the Bluegrass Community Foundation, the Greater Clark Foundation, and the Community Foundation of Louisville. If Dr. Susan Zepeda of the Foundation for a Healthy Kentucky, Jen Algier of the Greater Clark Foundation, Lisa Adkins of Bluegrass Community Foundation, and other representatives of these foundations are present, will you please stand up so we can recognize you? Who are too shy to stand up, but we're very appreciative. Thanks also to the University of Kentucky's Healthcare, Community Ventures Corporation, the Kentucky Department of Public Health, Kentucky One, HPCareer.net, American Heart Association, Voices for Healthy Kids, General Electric, and Blue Cross Blue Shield of Texas. All of these wonderful sponsors are highlighted in your program. And as Dr. Hacker said, I encourage you to take advantage of some of what Louisville has to offer in the little spare time we are giving you. But also, as Dr. Miller said, to take advantage of the many wonderful people who are attending here this year. Thanks again for being here.
Do go by the exhibitors and say thank you for coming. Thank you for being here. I just want to highlight that. They're investing their time and effort to be here, and I think we should recognize that and say, not only am I interested in what you're trying to talk to me about, but just simply say thanks for being here. I have the honor of recognizing the host committee. The Kentucky folks have been working with the Texas Health Institute to put this program together. There are 2 people that did not get printed in the brochure, so I'm going to highlight their names first because I do want to recognize them and make sure that we know that. Patricia Benson with Health Management, University of Louisville, their name is not in the program. And Jamie Sparks from the Kentucky Department of Education, his name is not in the program. They should be there. When I go through the names, if you don't mind, just stand, and then we'll hold our applause until everyone is standing. There's about 10 or so of the names I'll be going through very quickly. So, Pat and Jamie, you all can go ahead and stand up. John Kane of Action for Healthy Kids. Carolyn Dennis, you've already heard from Carolyn. Stevan Edwards, the Louisville Metro Department of Public Health and Wellness. Leanne French, Louisville Department of Metro Public Health and Wellness. Amelia Mendoza from the Foundation for a Healthy Kentucky. Ben Reno Weber from the Kentucky YMCA Youth Association. Elaine Russell with the Kentucky Department of Public Health. Melissa Streck with the University of Louisville School of Public Health and Information Sciences. And Susan Zepeda with the Foundation for a Healthy Kentucky. With that, you all have made us Kentucky proud. The folks from Kentucky know what that means because that's one of our agricultural tags of Kentucky proud. Thank you all very much for your support. Enough of the ceremonial hellos and welcome. It's time to get on. We're going to have presentations by 4 outstanding speakers. Again, their information is in the brochure, but I'm going to highlight a couple of things. The way this is going to work, this is informal. What I've said to them is, this is not a speech, this is a conversation. And it's a conversation with all of us. I'll be introducing all 4 at one time, then I'll be calling each one up to the podium to make some brief remarks, 10 minutes, whatever, of what they want to talk about. Following their remarks, we're going to be doing a polling question. You'll be seeing it up here, and that's what the clicker is for. So let me go ahead and get this out of the way. Your iClicker is on the table, and it's currently turned off. The bottom button is the power button of turning it on. So if you want to vote, you turn it on, and then vote, and you'll see what what you're voting for. Voting's going to last about 30 seconds, and then we'll broadcast the responses from this audience. After we go through the 4 presentations and the clicker between each one, then we're going to open it up for discussion. And by discussion, I mean the conversation. There's going to be a couple microphones up front, but we also have tweeting capability. And as I already mentioned, SOSKY 2014, tweet hashtag, tweets it, and then that'll be put on the computer and we'll be able to broadcast your questions there. So, Stephanie, I'm looking for you. Did I get everything right so far? Stephanie's not here. Okay, then I got everything right. Okay. I approved my response. Let me begin by introducing our distinguished panel. The sign says Gibson, but everybody else knows her as Mayfield. Dr. Stephanie Mayfield Gibson, but her professional name in Frankfurt is Mayfield, is the Commissioner of the Kentucky Department of Public Health. She's the Chief Health Officer of the Commonwealth of Kentucky. She was appointed by Governor Beshear in 2012. She's been at this job for over a couple of years, but she was actually in the Department of Public Health from 2005, so she's almost 10 years now, working on 10 years. Dr. Mayfield has a national reputation running the public health laboratory, and has been recognized even internationally. But more to the comments of the focus of this summit, she is actively working with Governor Beshear on a couple of really important initiatives that deal with the health of Kentucky, particularly dealing with the children's issues as well. One is on trying to decrease the overutilization of emergency room services by some patients who almost use ERs as a primary care physician, and that's inappropriate. We call those superutilizers, and she may have something to say about that. But she's heading that up for the governor. She's also co-chairing with the lieutenant governor a statewide leadership committee on health and all policies. And I'm sure she's going to say some things about this, so I'm not going to steal her thunder. So I'll stop talking about Dr. Mayfield, and I can talk a lot longer about that's Dr. Mayfield. And look at your program, you'll learn more about it. Larry Cohen is the founder and executive director of the Prevention Institute. Through that organization, he's involved with the Strategic Alliance for Healthy Food and Activity Environments, a statewide coalition in California that's really trying to shift the focus away from obesity being caused by or responsible for individual behaviors and really looking more at policies related to government or industry and particularly the environment and how we deal with the health, general health, but especially the problem of childhood obesity. Next to Larry is General Youngman. I first met General Youngman in 2001, in September 2001, when we were dealing with anthrax scares in Kentucky, as it was nationally. And of course, there were, unfortunately, some deaths from real anthrax. But every state dealt with this, not only the 9/11 trauma of the New York City, but powder showed up everywhere. And so General Youngman tapped into the Department of Public Health, and my predecessor, Bryce Leach, was the commissioner at the time, and Bryce and I worked with General Youngman. He retired in 2003 after 34 years of military service. And he retired as the Adjutant General for Kentucky, so he was in charge of our National Guard, and this is when I first met General Youngman. He now works with hundreds of generals and admirals nationally dealing with the issue of mission readiness. And mission readiness, I'm sure that General Youngman will be talking more about this, deals both with the poor health status of so many people in our young people in the United States, as well as the academic issues dealing with academic attainment, being able to serve in the military. So, John Youngman, thank you for being here. David Jones is the founder and CEO of Chrysalis Ventures. What this is a large venture capital company that focuses on how technology can be used to improve our lives, including improving our health. Technically, I think it's Davis Jones Jr., but he had affiliation with Humana, including serving as the chairman of the board for many years. That wasn't enough. He decided to run for the school board here in Louisville. And he has been on the school board for 2 years. Louisville has 100,000 students in the school system here, 27th largest in the United States. And so he has particular focus and concern about children's health issues as well as educational issues, because those two go together. We have an outstanding panel. I'm looking forward to hearing the remarks. We'll do the clicker thing. We'll go to the next one, do the clicker thing, do the next one, and then we'll open it up for discussion. And with that, I think I've covered all my stuff I'm supposed to do. So with that, Dr. Mayfield.
Greetings, everyone. I bring you greetings from the Cabinet of Health and Family Services out of Frankfort, Kentucky, and I hope you enjoy this conference today. Dr. Hacker, I can thank for bringing me into the world of public health. In 2005, he's the one who hired me and brought me in to run the lab. And our current Secretary for Health and Family Services is Secretary Audrey Tace Haynes, who asked me to be Commissioner, and at such an exciting time. When we think about obesity, we know it's going to take a comprehensive, multifaceted, strategic approach beyond the immediate healthcare arena to be successful in addressing these issues. We are very serious in our state of addressing the issues of obesity and the sequelae associated with such. This afternoon, I'd like to take a few minutes to talk to you about how we're putting health in all policy. That is how we're going to incorporate and promote a cultural change of health. And before, it's called Kentucky Health Now. Governor Beshear signed an executive order for Kentucky Health Now back in February of 2014. The Lieutenant Governor chairs an oversight team, and I co-chair the team because public health is the health of the public, and we walk across so many disciplines. Before I go into these 2019 ambitious but achievable goals for Kentucky and some of their strategies, I just want to let you know just how serious we are about improving the health. This oversight team is unique for us in Kentucky because it consists of the following people: the Chief of Staff for the Cabinet for Economic Development, the Legislative Director for Education and Workforce, the Secretary for Finance Administration Cabinet, and of course, my boss, the Cabinet for Health and Family Services. When we think about obesity and we think about having built environments, safe environments, we have the Secretary of this oversight team for Justice and Public Safety. We have the Director of Occupational Safety, Health Education and Training with the Labor Cabinet, Department of Insurance, Personnel Cabinet, Public Protection Cabinet, Legislative Director. And we have Transportation Cabinet Secretary, Executive Director of Office of Adventure and Tourism, the Governor's Office of Agriculture Policies, Chief of Staff, Coordinated School Health Director for the Department of Education. We have Energy and Environment Commission. Bruce Scott is our commissioner there. Kentucky Community and Technical College System, Public Relations Director, Commissioner for Department of Local Government, Department of Military Affairs, the Administrative Branch Manager, Council on Post-Secondary Education, and the Department of Veterans Affairs Commissioner. I know that's a lengthy group list, but these are the oversight people. This is how we at the state are playing our part of incorporating and complementing our success with the Affordable Care Act. One of the goals, there's 7 goals, with Kentucky Health Now, with multiple strategies. And if you want to see those goals, I encourage you to go to KY Health Now, that's one word, .ky.gov, and look at what we're doing. You may have seen us nationally from those who are not from Kentucky, and a refresher from those of us who are working and living and playing here. We know that there were, prior to the implementation of the Affordable Care Act, nearly 15% of Kentuckians uninsured. That was about 640,000 Kentuckians of a state with 4.3 million people. Currently, there are just over 500,000 people that have signed up under our insurance system called Connect. We are exceedingly proud of that. And as of April of 2014, when the open enrollment season closed, I have the differential breakdown of that, but that's looking at 413,000. Again, that's of April 2014. 52% of those that signed up under Connect were under age 35, and that has strong economic implications. Approximately 80% of those are insured by Medicaid now, and 20% qualified health plans. Now, I will ask all of you to help us here in our state, and for those of you in any states that are looking at expanding Medicaid under whatever you want to call it, but if it's an expansion, please help me with a change in terminology and not refer to patients as Medicaid patients. These numbers are fantastic, but we want people to access the system. And we don't want them to be stigmatized by calling them Medicaid patients. We want them to be able to go and have their providers address their obesity. We know also, so one of the goals is to reduce our uninsured individuals to less than 5% by all these goals are by 2019. No doubt we'll reach that goal. Kentucky smoking rate, we want to reduce that by 10%. For those of you who are not here from Kentucky, we have the dubious honor of being #1 in tobacco use. And adults, 28.3%. Nationwide is 19.6%. Our youth, Kentucky, 17.9%, and U.S. 15.7%. Though all of those are too high, tobacco continues to be the #1 cause for preventable death, disease, illnesses. So we want you to know that when we think about obesity, we have to think about the other factors that complicate a human being's life. So we did make some gain with the Department of Education in collaboration with the CDC's quit line, with our own quit lines, with the CDC's commercials on tobacco. We looked at cigarette smoking in high school students, and in 2011 it was 24.1%, and currently is down to 17.9%, with a national average of 15.7%. Still too high, but success. We continue to aim for a comprehensive secondhand smoke-free legislation. In the interim, until we get that, our governor, along with our legislators, came to the conclusion that we were not going to sell e-cigarettes with or without nicotine to minors. And that is we were very pleased with that. And most recently, smoke-free policies in our executive branch. The governor signed an executive order just this September of 2014 stating that executive buildings, grounds, and fleet will be tobacco-free and e-cigarette-free. This is monumental in our state of Kentucky. This will affect hundreds of thousands of visitors, tens of thousands of employees, and thousands of properties around the state. Currently, and this is a very serious problem for Kentucky. We currently, when we talk about school systems, we have 173 districts, of which only 37 have tobacco-free policies. We're making progress, but obviously we have more to make. So, on obesity, we want to reduce the rate of obesity among Kentuckians by 10%. As Dr. Hacker said, we know our statistics. Our Kentucky adults, 31.3% obese, with the U.S. national average on 2012 data, approximately 27.6%, and youth 18%, and U.S. 13.7%. So we definitely have a problem here. I encourage you to visit our table that we have set up to look at our multiple partners that we're working with to address obesity. What are we doing at the state with all of these partners? With finance, we're working on looking at our vending machines. Why is it, we asked our secretaries on the oversight team, that our employees are paying more for a pop or soda, if you will, than paying more for water than a pop or soda? Why is it that sometimes we don't even have water in our machines? We've also started the healthy meeting policies, whereas we said, okay, there'll be no sodas in our public health meetings. And it was a collaborative agreement there. And with that, we said, okay, if we want to serve something sweet, have more of something that's healthy. And what we found is people default to the healthier choices. We have water, we have cucumber water, we have lemon water. These may sound like baby steps, but what it's doing, you're helping to promote a culture of health. We have 120 counties, and I look out, I see some of our health department directors, and they have various activities. What else are we doing? We have Better Bites. Is Dr. Connie White out there? You want to stand Dr. Connie White, our senior, she's our Deputy Commissioner in Public Health, and she has been active with the Better Bites along with Elaine. Russell, you want to stand? And any of our other staff here, please stand that are active with our Better Bites. We noticed that people weren't eating much of the food in the cafeteria, or they were opting for unhealthy choices. Since then, we have seen statistically differences in the choices people are making in the cafeteria. We're also looking at our environment in the Kentucky Health Now. We have the Dawkins Rail Line in eastern Kentucky, and many of you may have heard of our Shaping Our Appalachian Area Region, Getting It Healthy, our SOURCE project. And with that, we know that there are increases in morbidity and mortality associated with some of the things we're discussing now: obesity, cardiovascular disease, cancer. We have a Dawkins rail line there, which 18 miles are completed, and the goal is 36. When we put these type of built environments into areas that may have been economically depressed, we see that they're not as stagnating as rapidly economically. Their bed and breakfast shops pop up. We also see what else? They have bicycle shops, but eventually we'll start seeing this obesity cycle turn around. Obesity and cancer. Our goal is to reduce cancer deaths by 10%. Currently, Kentucky is above the national average in deaths from all cancer. We've seen obesity. We know obesity can be linked to esophageal cancer, endometrial cancer, breast cancer, pancreatic, colon and rectum, more commonly in men that are obese, gallbladder and thyroid cancer. We have every reason to work on obesity and watch our risk of cancer decline. Cardiovascular deaths. We're high in cardiovascular deaths. Obesity is related to increase in blood pressure, increased cholesterol, triglycerides, and a decrease in the healthy cholesterol, the HDL levels. We see increases in diabetes and increases in stroke. So addressing obesity helps us to address chronic diseases associated with it. Another one of the goals is treating children with untreated dental decay. So I need to wrap up. I'm getting excited. So you know. We don't want Mountain Dew in the bottles. We want to educate people. And if there's another thing I can leave you with, our other goal is to reduce drug overdose. We have a real problem in our state and unhealthy mental days. So I hope in the conversation ensuing over these next couple of days, we look at obesity and mental health. There is a correlation with medication and diseases, and we don't want to leave anybody out of the fold. Thank you, and I apologize for going.
She does. I said, whoa, Nellie. She does. She's passionate. Stephanie, are we going to do a polling question? We are. Remember, turn on your clicker, and I'm going to read the question once it shows up on the screen. On a scale of 0 to 10, how much do you think the nanny state is a problem? You got 30 seconds. You can think about that. I suspect you all know what that means. It's fairly straightforward. If anyone does notice that, raise your hand or ask your neighbor. Nanny state, does the government try to teach you, take care of you, be your nanny? You know, it's taking over individual responsibilities through government action, and a negative concept.
Is 0 yes or no?
I wish we had the song in Jeopardy. Thank you. Give her a microphone. We got a plan here. All right. Are we through, Steph? We're through. Okay. We're going to ask the panel if they have any comments they'd like to make. Short, comments regarding the results of the panel here. Is there a second question? There is a second question, all right? When everything around us encourages unhealthy decisions, the role of government should be to do one of the following. Stay out of it. Any action could lead to a slippery slope. Provide education on healthy options. Convene industry to change their practices. Create regulations to protect our health and safety. And Stephanie, I'm looking back. They can vote to more than one thing. You can only vote for one, so you get to choose one. Stay out of it, provide education, go to industry, create regulations. So if you were king, what would you focus on? And what's that tune again? There we go. All right. Now it's time for discussion. 2 questions, and then with this one, obviously the nanny state, and then secondly is what's the role of government? Dr. Mayfield, do you have anything you want to say?
Okay, can you all hear me in the back?
Yeah.
Well, I just got through talking about government and putting health in all policy to help incorporate a culture of health, help us default to healthy choices. So I think that, and I also made a comment that it's going to take all of us on board. It's going to take public and private partnerships, but most certainly government plays a role in ensuring you have healthy foods to eat. We have the new Food and Safety Modernization Act. We have tobacco. We're trying to get a comprehensive tobacco law. So government plays a significant role in creating regulations, but we also play a role, and that is why that oversight team is so comprehensive, because there are numerous partners in the public, in the private sector that we work with as well.
I'm the one who created these questions, and I did because I was asked to talk about policy in this session, and nanny state is a term, and I think it's a term that's worth looking every time the term comes up, who brought it up and what the origin was and why.